Recording from the Sunshine City, St. Petersburg, Florida, overlooking beautiful Tampa Bay, this is the Sonography Lounge, sponsored by Gulfcoast Ultrasound Institute. This podcast is dedicated to medical professionals and patients around the world interested in diagnostic and interventional ultrasound. Our podcast will discuss everything ultrasound, from news, trends, career paths, new technology, and industry updates. Hosted by Lori Green and Trisha Reo of Gulfcoast Ultrasound Institute, they bring over 4 decades of experience in the ultrasound profession and are here to guide you through this journey. Now sit back, relax, and enjoy.
Hey everyone, and thank you so much for joining us on the Sonography Lounge, where we talk about all things ultrasound. My name is Trisha Reo, and I'll be co-hosting today's episode with Lori Green.
Hey everybody.
Today we're going to chat about some upcoming MSK ultrasound courses that we have on our calendar. We're going to dive into what those courses will include, the various course formats that we offer, as well as who these courses are designed for, and basically what you can expect when you attend a Gulfcoast Ultrasound MSK course. Lori, why don't you start us off and just give us a brief overview of the MSK courses that we offer?
Sure. Our MSK courses are one of my favorite courses. We just have such a wonderful time and get to work with a lot of great people. And so we have one coming up not too far from here now, August 19th to 21st. We have our introduction to MSK ultrasound. We offer that twice a year. It's our live traditional education format. So we usually offer it in January of each year and then again in August. So the next upcoming opportunity is August 19th to 21st. And this particular course offers the perfect blend of didactics and practical experience with a strong clinical focus. The course is designed for any clinician, sonographer, or other medical professional who has a desire to learn how to do diagnostic and interventional ultrasound scanning techniques, as well as interpret those exams. We cover both the upper and lower extremity, so all joints are covered. So it's not just a focus course on one particular joint, but you're able to actually work with the experts on learning both upper and lower extremity diagnostic ultrasound. So this particular course is 3 days in length. As I said, it's a traditional education format. So you're going to participate in comprehensive lectures on diagnostic ultrasound. And then after each lecture, we do a scan demonstration of the joint that we've been discussing, and whether that's upper or lower extremity. And then following the scan demonstration, we break the participants into 2 groups. And while one group is scanning, the other group is involved with a lecture on the pathology of that particular joint. And one of the things that we really shine is with our hands-on skills training, because it's in small group setting. We don't have any more than a 3-to-1 participant to instructor ratio. And all of our lecture faculty, as well as many of our table trainers, are leading experts in MSK ultrasound, and these people are internationally recognized. They're the experts who wrote the books on how to perform and interpret MSK ultrasound. So we're so fortunate to have a long-term relationship with all of our instructors to be able to work with you and make sure that you're able to actually go back and immediately integrate these skills.
Yeah, and they come from a variety of backgrounds, right? Specialty practice backgrounds.
Yeah, absolutely. We have our participants come from many different specialty practice backgrounds, which has their own unique needs and interests of what they need to learn and how to apply that into their patient population. And so how best to address that than to have our faculty also meet that. So, we have our experts are from sports medicine, orthopedics, radiology, rheumatology, PM&R, chiropractic medicine, regenerative medicine, and even physical therapy, which is a growing application area. So, the one thing I mentioned is that we do offer a very robust scanning skills training, and that's so important when you are planning to attend a program, is to make sure that you are going to get that scanning skills training. You can sit through all the lectures you want, but not be able to scan. It's that hands-on that really makes everything click and allow you to be able to fully understand and comprehend what you're learning. So as I mentioned before, our course allows for you to scan with the experts in a 3-to-1 or less participant to instructor ratio. And during these hands-on scanning opportunities, you'll be scanning standardized patient models with different body habitus, different anatomy, some have pathology, and so forth. You get a lot of opportunity to scan so that you're ready to scan. You know, if you're just scanning easy, normal patients all the time, then you're not going to be best prepared to be able to go back and apply these skills. So during these hands-on scanning skills sessions, when you're scanning the models, you will be guided with your expert instructor, and they'll be providing some formative feedback and some of their unique insights, because you're going to be working with people that are similar specialty backgrounds, so that you can improve your personal experience. And then we also talk about interventional techniques. And so in the introductory portion, we do have inanimate phantoms that we utilize to allow you to practice your ultrasound-guided needle techniques for interventional procedures.
Yeah.
Basically, with the hands-on skills training, that's involved in the basic part of the program. And then we also offer an optional cadaver lab. And that's an excellent opportunity to just take your skill set to the next level. We utilize unembalmed human cadaveric specimens, so that gives you the opportunity to actually learn and develop your injection skills on the anatomy that you're going to encounter when you go back to your clinical practice, and you will have the competence and confidence to be able to do so. So by blending the inanimate phantoms along with the cadaveric specimens, just further improves your confidence and competence. And then we also have that ability with the cadavers to use the landmark-based techniques with needling, which further enhances your knowledge and understanding of the three-dimensional anatomy and practicing your skills such as your hand-eye coordination, your probe handling on an irregular surface, and probe needle alignment for MSK-related guided injections and interventions.
Yeah, it can't be, minimized, that experience when you are going to put a needle in a patient to see, okay, if I'm doing an elbow injection, where am I going to be? How am I going to position myself? Where's my monitor going to be? How do I hold the needle? And how do I hold the probe and the needle at the same time? Like, it's just, I think going through it and doing it on an actual limb is really important. And obviously, we're not going to sign, live models up to do that. Nobody's going to come in and be willing to do that unless they're going to get a free treatment out of it, which we'll talk about here in a minute.
Exactly.
But it gives you that chance when you're working with those cadaveric specimens to really get your hands on, and then have the expert instructor standing next to you as well as your co-participants. I mean, don't underestimate the value of their experience, the people who you're working in your group with, because I hear a lot of times them exchanging information and sharing tips and tricks and what has worked for them, what hasn't worked for them, and just having that real life experience. It's just, you can't replace that. It's actual.
And there's different ways of being able to perform these injection techniques. It's not just one approach. There's a lot of different ways to evaluate and actually perform the interventional procedure. So by using these cadaveric specimens, we're able to go through the various, okay, well, in this situation, we're going to come in from this approach because the anatomy is this or that. And so there's a lot of different ways that you can perform these injection techniques. And as we said, we group you with like specialty practice participants, so your questions are going to be closely aligned to what you're going to be experiencing when you go back to your clinical practice. So there's definitely nothing that can replace actually doing the interventional procedures on a cadaver.
Yeah, it's true. So immediately following that introductory course, which is 3 days in length, we then begin our 2-day advanced interventions in regenerative medicine MSK course. So that's out of the 5 days, 3 days are focused on the intro, and then we go into our advanced program. So this 2-day course can be attended by anybody who has that experience and competence in diagnostic ultrasound, and now they're looking to take it to the next level, integrate some of those more advanced applications, such as peripheral nerve or spine ultrasound, or they want to get into doing, tendinopathy and tenotomy evaluations and treatments, or they want to learn regenerative medicine applications. But it's also able to be combined with the intro course. So if you are making a trip and your travel time it allows for it, you can take the full 5-day complete program, and then you won't have to split it up and come back and do 2 separate programs with us. So it's a nice flexibility for those who are going to already be here for that introductory course and allow them to minimize their cost and travel time associated. So this 2-day advanced course, it incorporates more comprehensive lectures, as I mentioned, on spine and peripheral nerve diagnostic ultrasound, the tendinopathy and tenotomy, regenerative medicine applications, including prolotherapy, platelet-rich plasma, also known as PRP, the bone marrow aspirate concentrate, and the lipoaspirate therapies. This course does include a 4-hour interventional cadaver lab, so it's not like the intro course where that's an option. You can add it or not add it. It actually includes it because we want you to have practical experience with those more advanced interventions, and you'll be able to do that. And then we wrap it all up at the end on Friday afternoon with PRP demonstrations on actual patients with the opportunity for discussion and Q&A. So you get to watch one of our expert faculty perform PRP treatments on actual patients with real pathology and ask them questions. How would you do this? Well, what about this? How did you mix that concentrate? What are you using? All those questions that you have will be answered during that session. So it's really nice. And if that's not something that you are interested in doing, we also offer a optional open scan lab, so you can spend more time scanning some of those more advanced techniques with our expert instructors if you prefer to do that. So lots of flexibility in that program, and it is a fun program to attend. And I do recommend you come for all 5 days because you won't want to leave after day 3.
That's absolutely right. And that open scan lab, if you do decide you don't want to participate in the PRP demonstrations, that we do have expert instructors in there.
Yeah.
It's just an open scan lab, meaning that you're able to work on whatever you feel like you need a little bit of extra help with, and you can actually float back and forth too. You can watch a couple PRP procedures being performed, and then get a little bit of extra hands-on if you like. So, like
do what
Trisha
you want
said,
to do.
a lot of flexibility there that allows you to get the full scope of education that you need in particular.
Yeah. And, speaking of the hands-on, we've mentioned that multiple times, and we say that because participant feedback from our previous courses, and we've been doing this a long time, and it's consistently strongly supports that the hands-on scanning sessions in the cadaver labs are the most effective portion of the program, specifically the repetitive format. So you attend the lecture, you watch the live demo, you go into hands-on, and you perform it. And you do that for each and every joint through the intro program. So that repetitive nature really helps people take it from I'm learning this application to I'm actually doing this application, so they get to put it into practice. And I think that makes a major difference when you go back and you start to integrate this into your own clinical practice. Let's talk a little bit more about our formats. We have that intro MSK course. We also offer that as a blended format. Lori, can you tell our listeners why this flipped classroom approach is so effective?
Sure. We added in blended format programs many years ago, and that involves being able to complete your didactic portion of the program in advance before actually coming to our facility and spending the entire time scanning. So with the blended program, you're able to focus completely 100% on your scanning skills when you're here versus sharing with lectures and hands-on. But you're still working with the same expert instructors that are here many of them are here during our traditional education format. But the online course you'll start with is where you'll get your didactics. And these are professionally broadcast quality recordings of a previous live course. So it's the same exact lectures that you would get if you were here in our traditional education format, but they're just recorded and they're put in a modular format that you can view on demand. And so you have unlimited access for 15 months. So that's the perfect opportunity where you're able to view all the lectures as many times as you want before you come to our facility to a scheduled hands-on blended program. You'll spend 2 days here scanning both the upper and lower extremity applications. And then when you go back home, you're able to still have access to those lectures to reinforce the additional information that you've learned while you were here scanning. So it gives you that many people prefer to have that opportunity to kind of review and reinforce what they learned rather than a one and done where they're doing the lectures and the hands-on. So it really depends on your education preference. But once you've completed the online course, we do recommend that you actually complete that before you come.
Yeah.
Otherwise, it's kind of like putting the cart before the horse. You don't want to just come in and have not looked at any of your presentations. You really want to watch all of the lectures before you come, then you're prepared and you're ready to really get the most out of the hands-on experience while you're here. And just like in our traditional education format, our hands-on skills training are set up with standardized patient models. We don't have more than a 3-to-1 participant to instructor ratio, and that gives you the most individualized attention. And then we also still have our inanimate phantoms that are here, so you can practice your ultrasound needle guidance techniques as well. This particular course coming up next is going to be in October. That particular one does not have a cadaver session incorporated into it. So if you want to be doing some interventional techniques, then you might want to consider coming to the August course and attending the optional cadaver session.
Yep, for sure. Yeah. And we've said it. I don't mean to be like a broken record over here, but we've talked about the hands-on. And I think the reason that we push the idea of the hands-on so much is because, one, we have experience. We know through 39 years of teaching ultrasound and how to incorporate ultrasound into your clinical practice, what works and what doesn't. And lately we've seen a lot of people out there claiming that didactic-based learning is a strong educational pathway for somebody looking to incorporate MSK ultrasound into their clinical practice. And we know from experience that that's not true. The didactic, while it's a vital component of learning and it is part of your educational pathway, it is the hands-on skills training in small groups, not 6-to-1 or 7-to-1 or maybe even a whole group of people with one instructor floating around from station to station. That does not work. You need small groups so that you have ample practical experience with an expert instructor who's literally standing next to you, giving you that feedback, giving you those tips and tricks. I hear it all the time, like what this physician said to me when I was doing the shoulder, it just changed everything for me. Those tips that I'm walking away with are going to change how I do this. I've been doing this. I've been struggling. Now I see how they're doing it, and I'm going to go back, and that's how I'm going to do it. So you can't undervalue that feedback from your expert instructor while you're standing there, and then you're getting that, it's a muscle memory kind of thing. You really need to perform ultrasound multiple times, scan. I was having this conversation with Lori last week. I said, I've been doing diagnostic ultrasound for over 15 years, and I've sat through how many of these MSK lectures? And granted, we're usually working in the back of the room, but we pay attention to a lot of them, and I could not sit down and go perform a shoulder ultrasound right now if I wanted to, no matter how many times I've sat through those lectures, because I don't have the skills training. I haven't gotten to work with an expert instructor and actually got the hands-on experience on a standardized model with the repetitive nature where I can then integrate that into my clinical practice and take that and run with it and develop my skill set. I'm an expert in vascular ultrasound. I'm an expert in abdomen and general ultrasound. Nope, not an expert. Can't do MSK ultrasound. It's because I don't have the skills training. So I'm sitting here telling you, as somebody with 15 years of ultrasound experience, the skills training is where it's at. You have to have the skills training, and again, we have that 39 years of experience and our consistent participant feedback stating the hands-on scanning sessions were absolutely the most effective portion of this program. So please don't be fooled by what you're hearing out there, that you can just take some courses online and then walk in and be able to start performing ultrasound on your patients. You really need to come to a hands-on course, one that is focused and will give you ample scanning opportunities with expert instructors in small groups on a variety of models, on a variety of systems.
Right. And just to reiterate, and not to run this into the ground, but it is so critical because a lot of times people do, those people, the sonographers and clinicians who are experienced scanning, they make it look easy.
They do.
They know the anatomy. They understand the mechanics of manipulating the transducer and optimizing the gain controls on the ultrasound system, and being able to recognize the anatomy and what's normal, what's abnormal. Is that an artifact because I'm not scanning appropriately, or is it really pathology? And these are things that you learn over time, but you really have to have that hands-on skills training in the beginning. And like Trisha said, you can be scanning, even be an expert in another specialty, but just because you know how to do vascular or cardiac or abdominal does not mean that you can just sit through some lectures and you automatically are going to be able to scan MSK. It's a completely different way of manipulating the transducer, the angulations, and manipulations of the transducer are completely different than scanning an abdomen or vascular or whatever the case may be. So we hear that a lot because people will call and say, I know how to do cardiac, so I know I'm just going to be able to listen to a few lectures and do the hands-on training, and it's absolutely not true. So
it's not.
It is very vital to be able to get a robust amount of hands-on skills training with that feedback. And not only do you have the opportunity to work with the experts, but we do provide scanning checklists that you're able to take home with you and use as a reference, and other support strategies that you get along the way that pertain to it. So all of these things combined are what make our courses so comprehensive and allow us to have that 99 consistent 99.9% satisfaction rate for meeting or exceeding their educational objectives, and being able to actually go back and immediately implement those skills into clinical practice, which is what you're here for. Right?
Yeah, exactly. So. And we're saying this not because, of anything other than we have heard things in our industry, especially recently, that are, in our opinion, misleading. We feel like the information is misleading, so we want you guys to have the hard, cold truth. It's a fun course, so it's not like it's terrible that you have to come do this in person, but we want you to have the information because we don't want you to waste your money, waste your time. Oh, I just need some CME and I'll be fine. No, you need training. There's a difference. Continuing medical education, we are huge supporters. That's what we do. This is continuing education, but you need skills training or you're not going to be able to be as effective and successful for your patients as you want to be. And we just don't want the bad information out there to mislead or misguide you into thinking that it's going to be anything other than that.
Right. It's like anything else. When you first start something, you're not going to be the best at it. Practice makes perfect, and you have to continuously. Ultrasound in any specialty is a continuously learning, career. You cannot stop learning because technology is changing. Even diagnostic criteria changes along the way because of the technology changes. And so you have to really keep up with what's going on. And the only way to do that is just to continuously scan, to develop that expertise. And, you might start out, a shoulder might take you 45 minutes to do, down the line, after you gain that expertise and the proficiency and from practicing over and over and over again, you're going to see that time it takes you to do an exam is going to decrease. Your quality of your exams is going to get better. But how are you going to do that without having a strong foundation to build on? And that's what we're providing to you here. A strong foundation that you can go back, immediately integrate those skills learned, and build on your skill set and your proficiency over time.
And be less frustrated.
Right.
Like, we don't want you to go home and be frustrated.
Yeah.
You're going to leave here confident.
Absolutely.
Yep.
Let's move on just a little bit with just talking about the different formats. We talked about the traditional education format that gives you the opportunity to be here in person and interact in person with the expert instructors. We've talked about the blended education formats that gives you a little bit more flexibility in terms of when you complete your didactic components and be able to come and just scan and not divide up your time between lectures and hands-on, and be able to go back and reinforce those skills by re-reviewing that information that you have 15 months access to.
Yeah.
So, really that's an individual decision. On some people prefer the in-person and some people prefer the blended education format. Either one is going to give you the skill sets that you need to be able to integrate the MSK ultrasound into your clinical practice. So regardless of the course format that you choose, you can count on having a comprehensive experience utilizing Gulfcoast Ultrasound's CME experiences for you. And, I think it's important to just reiterate, we've been in business since 1985. We are approaching our 40-year anniversary, which is incredible. That was a very fast 40 years.
Right.
But we've been around the block a time or two. And we have changed over time as technology changes, as ultrasound. I mean, look at ultrasound, where it's come over the years,
Right.
From just being pretty much radiology-based and cardiology-based, and then OB to some degree. And now we have ultrasound being performed by so many different specialty practices, which is amazing.
Right.
And it's so important for improved patient care and safety that we're able to integrate those skills into clinical practice right in the office.
Right.
And, just think of the patient satisfaction with that. They don't have to, just wait to go get an MRI and then wait for those results and then come back and then maybe you have to have something else. You can basically find out what's going on with your patient and determine the best path for treatment or management right then and there.
Yeah.
And so taking that step is really important. And yes, there is a learning curve to it, but you really want to make sure that you're doing your due diligence and knowing what you're getting when you're registering for a program.
Please, yes.
And I think that's really important.
Yeah.
And then we are a woman-owned small business based here in the United States.
Lori Green.
So we're very proud of
Founder
that.
and president.
And we take a high level of pride in the quality of education that we offer here at Gulf Coast.
Yeah.
All of our staff works together as an amazing team, and the quality of education, but also the level of customer service that we provide is super important to us. So, I can tell you firsthand from working with, all of our staff has been with us for many, many years, and all of the faculty that we work with, they're like family here.
Yeah.
We've been working with them. I mean, we only work with the best of the best. And so you'll see that if you went back and looked at our instructors who we work with, we've worked with all of these instructors for some of them over 20 years. But most people that we work with them for years on years to come, and we grow together. And so I can tell you that, we promise that if you choose to come to Gulfcoast Ultrasound, you're going to have an exceptional education experience. Mm-hmm. We take your education needs personally, and we will do whatever it takes to make sure that you leave here with what you need to get started in integrating these skills into practice. So, we personally invite you to join us at one of our upcoming programs. If you have any questions, we are here all the time, and our staff is more than happy to talk to you in person in a phone call. You don't have to just email or chat us. We have that available too, if that's the way that you want to communicate. But just give us a call, and if our administrative CME coordinators aren't able to answer your question, there'll be somebody here that can, and we'll make sure that you get signed up for the appropriate course for your needs so that you get the most out of your educational experience here.
Yeah, I would prefer that you guys pick up the phone and call us before registering if you have any questions. That way we can make sure you're getting exactly what you want. Right. We're highly trained. We know what you need. We know our programs inside and out, so we can make some recommendations and make sure that you get registered for the course that's going to best meet your needs and deliver the educational content that you're looking for in the format that's most appropriate for your learning style. So, all right. Well, I think we're out of time. It's been fun sitting down and talking about our exciting upcoming courses. Again, we have the live Introduction to MSK Ultrasound course. That's August 19th through the 21st, 2024, followed immediately by our Advanced Interventional and Regenerative Medicine course. So that is the Thursday and Friday. That would be August 22nd and 23rd of 2024. And then if that blended format sounded like something up your alley and you're not looking for an interventional cadaver lab, that is October 17th and 18th of 2024. So we invite you to come join us, have some fun scanning with us, and and we totally look forward to working with you. I'm super excited to meet you guys and work with you and help you take your skills to the next level. So we want to thank you for joining us in the Sonography Lounge today. We also want to invite you to check out our other MSK-related podcasts. Our podcast is here to provide you guys with the information and the content that you're looking for. So I invite you to check out episode 37, that is MSK Ultrasound and Physical Therapy, featuring Dr. Charles Stevens. He talks about his own personal experience taking the RMSK Registry and how he has integrated physical therapy into his daily clinical practice. It's a great discussion. And then we have episode 40, Explaining Regenerative Medicine, which is a high-level discussion on various regenerative medicine options, and that features some of our distinguished experts, Dr. John Broussard, Dr. David Wang, and Dr. Imran Siddiqui. So be sure that you check those out, and don't forget to subscribe so that you don't miss any upcoming episodes.
Absolutely. We thank you guys for joining us, and we hope you have a wonderful day, and happy scanning.
Happy scanning.
Thanks for listening to the Sonography Lounge. Don't forget, if you like this episode, please subscribe and leave us a review on iTunes, Spotify, or wherever you get your podcasts. You can also find us on Instagram at Sonography Lounge and Twitter at SonographyLNG. If you have any questions, comments, or topic suggestions, feel free to send an email to us at sonographylounge@gmail.com. Have a great week and scan, scan, scan.